Hi, I'm David Cornelder. I'm the medical director of the emergency room here at Mahaska Health, and I'd like to answer some commonly asked questions that we're hearing and concern, of course, about the COVID that everyone's talking about. So one of the concerns that I have with all of these precautions and the social distancing that everyone's doing is that somebody would be at home getting sicker with their um, shortness of breath or chest pain or some other symptoms. And those are people we don't want to miss, and we don't want people to get really sick at home and make it much more difficult for them to recover. We still want people to come in when they're sick. So a common question is, you know, am I, is it really an emergency? Uh, if you are having significant symptoms like chest pain or shortness of breath or something like that, if you're very worried, we want to see you. If you have a mild fever and you're feeling okay otherwise, you probably should just follow the state guidelines and stay at home. But if you're getting worse, if your symptoms persist or get worse, or get new symptoms, then I think you should be evaluated. So another message that I would really want to get out there is our elderly community, and you might have a neighbor or a relative that's home alone. Maybe they need some help. They may need some food, or but it'd be worthwhile to check on these people, even just calling or knocking on the door, and keep a safe distance. Just stand outside and talk to them, find out if there's anything you can do for them. But our concern again is that people would be home and not have any way to access health care. And if they're truly getting sick out there, we need to know about it. We can, the ambulance can come get them, or if they have family that can drive them in, that'd be good. I think one of the concerns as taking care of the health of our population is that we don't want people to just linger at home and get worse and get sick. And if there's somebody you can look in on, call them up, make sure that they have adequate food and supplies, and if they're sick, that make sure they have a way of accessing health care. And so a couple of things you can do. One, you can call your doctor's office, of course, during the office hours, and talk to your doctor or your doctor's nurse. We also have a telehealth line set up, and that phone number is 641 672 3360. And so if you call that number, then you can actually visit with a provider through the phone or through your computer or your iPad. If you need to call the hospital or it's after hours, you can call our number here at 641 672 3100.